Alcohol intoxication means being drunk. Drinking a lot of alcohol leads to being intoxicated. Your thinking may not be right, and your body struggles with the alcohol. You can't walk straight. Alcohol changes your brain chemistry and your behavior. You lose your sense of balance. It can hurt your body and your brain. You can be slightly tipsy all the way up to severely drunk. There are 3 reasons that a person can become more seriously drunk. Age is a factor if you're a much older person or a very young person. If you have medical problems such as diabetes, have a seizure disorder, or a heart problem. If you take a prescription medication and you drink, they might not mix well, and that can be dangerous. Also, smoking pot or using cocaine or any other drugs can be dangerous mixed with alcohol. Here is a list of symptoms that you'll notice if you are drunk or intoxicated. You're off balance and can't walk straight. Your mood swings up and down. Your friends notice that you're not behaving as you usually do. You can't think clearly. And your signing communication is not clear. If you decide to keep drinking a lot, you may have these things occur: vomiting, confusion and forgetting things that just happened to you. You may have trouble breathing. You could have a seizure. You could pass out. The doctor will be able to diagnose if you're intoxicated by asking you these questions. What did you have to drink? How much did you drink? When did you drink? The doctor will examine you, and sometimes you'll have a blood test to see how much alcohol you had. Each state has a different number to officially determine that someone is drunk. In New York State, that level is 0.08%. If you have above that amount of alcohol in your blood, you will not be allowed to drive home. If your number is much higher and the doctor thinks that you don't look quite right, the doctor will want to keep you longer. If a blood test comes back with a safe level, you'll be allowed to leave. Most people don't go to the hospital when they're drunk. The effects of alcohol are fairly short because your body gets rid of it quickly by going to the bathroom and sweating. The doctor may give you an IV drip or more water to drink. If the doctor looks you over and thinks that you're fine, you'll be sent home. Here are some things to do when you get home from the hospital. Don't drive. Drink a lot of water. And if you notice that your urine is dark yellow, that's not good. The color should be light yellow or clear. If you want soda or coffee or tea, it's not a good idea to drink them yet because they contain caffeine. It's just best to drink water. If you want medicine to help with headaches or body aches, you can take Tylenol or Advil. Or if your doctor gives you particular medicine, use that and follow the directions. Go back to the ER if any of these occur. If you decide to stop drinking but your body reacts by shaking, having tremors, go back to the ER. If you vomit and there is bright red or black in it, go to the ER. If you use the bathroom and you notice red or black in your stools, or if they are sticky, if you feel confused and dizzy, like you might pass out, if any of these happens to you, go back to the ER. See your family doctor, your PCP, if these happen. If you keep vomiting and it doesn't get better. If you don't improve over the next 2 or 3 days. If you keep drinking and you don't feel like you can stop, it could mean that you have a problem with addiction, alcoholism, and you need to ask for help. If you experience any of these, talk to your family doctor, your PCP, about them.